well. Yes, eat more of veggies, fruits, go nuts on nuts. Eat less, yes, eat less. Less of carb, fat, and no to soda pop. Exercise well, walk, jog, run, bike, treadmill, elliptical, till soaked in sweat. Exercise more, 5 times a week, half hour or more, till soaked in sweat. Hi, I'm Dr. Rhema Zachariah, a physician, and we are continuing with our series called Holistic Health and You. And here we have the several experts on holistic health, from the personal performance that we have, the whole setup. Would you explain to us what do you have here and how you relate to the whole person? As our focus is on the whole person and the holistic health.
Well, I'm a naturopathic doctor, and basically what I do is assess through live and dry blood analysis or assessment different pathologies in the blood. It's more research work, and we make suggestions in terms of vitamins and minerals and herbs where we can see deficiencies. I'm also a registered kinesiotherapist. Your kinesiotherapist, basically you're in VA hospitals. I'm one of 2, maybe in a 100-mile radius. We are exercise specialists. We use movement to rehab the body. And I'm also a licensed massage therapist, so we do soft tissue work as well. Massage therapy to deal with scar tissue, joint limitations, to get joints to move better through 4 ranges of motion. We also have an athletic trainer. We have personal trainers. We have massage therapists. And we try to treat the person from the inside out, holistically.
Yes, and this brings the particular question that this is very specialized for athletes and those who have athletic injury. You have that expertise, right?
Yes, we do.
But we like the people who are seeing this are people like me, just ordinary folks. So what do you have for ordinary folks like me?
Well, it depends, again, when a person comes to us, it depends on their condition.
Yes.
It depends what they want, what their goals are. If they've come from surgery, we can do rehab. We do balance training.
Yes.
We do, again, soft tissue massage.
Yes.
We offer that. We offer rehabilitation from joint injuries and surgeries. So we pretty much cover a gamut from little children. We have some people coming in here who are in their 70s and 80s.
Excellent. And one of the problems, let's say some of the common problems, is sitting in the couch day in and day out.
Yes.
So therefore, what are some of the problems that you encounter for couch potatoes?
Well, we see a lot of low back pain.
Low back.
Yes. Especially for people who sit a lot.
Yes.
What happens is basically, if you understand anatomy, the psoas
Yes.
is a hip flexor
Yes.
that attaches in the back of T12, the
Yes.
thoracic
Yes.
spine, and runs into the medial border of the trochanter or the femur.
Right.
And when you sit for a long time, the hip flexors shorten.
Mm-hmm.
So when you stand up, because of the way the psoas contracts, it pulls the pelvis into an anterior shift.
Yeah.
And so we have to really work a lot with posture,
Yes.
getting the core strong,
Yes.
getting the glutes strong, getting the abs strong,
Yes.
getting the posterior muscles, the
Right.
thoracic muscles strong. So those are the things that we do to help rehabilitate those areas.
Yes, that posture is so important.
Yes, they're the anti-gravity muscles.
Right.
Yeah.
And so you would show us some of the equipments and apparatus that you have that takes care of the different aspect of muscles and joints problems.
Yes, we can do that.
Yes.
We always start with the core. Whether we're rehabbing someone or whether we're training someone, blood flow begins here with the heart, the core, and it flows out. So we like to warm up the core first, and then we go to the extremities. So we start with back hyperextension. Back hyperextension isometrically works the hamstrings, the glutes, and he's going to take his erector spinae through about a 20-degree range of motion, which is what the erector spinae extend the torso, no more than 20 degrees. And so if you notice, right away we start with the palms facing the floor in an externally rotated position with the humerus, which basically engages the infraspinatus. His scapula are adducted, or basically he's retracting his scapula using his rhomboid, so we're working his posture right away. All right, and what we're going to do is here is all the smaller muscle groups, the multifidi and so on, the longissimus, the erector spinae group, which is a larger group, but there are also many smaller muscle groups in the spinal cord that are very important that most people don't train. And so what we're going to do is he's going to lower himself, nice and slow and controlled, because that's how you really stimulate the smaller muscle groups. He's going to come up to about 20 degrees and down. And he's going to come up and down. And from here, after we do about 12 reps, we also move side to side to strengthen the obliques as well. So now we've touched several muscle groups just in this one movement. Okay? Now, the beauty of what some of this equipment, go ahead and stand up, son, is this machine. Once you show how the machine can go up, if we have older people who are in their, we have some people who are 80, even lower, one more, who are not strong enough to be at the angle that Sam was, so we start them higher and just have them move through a short range of motion and just learn slowly but surely to stimulate those muscle groups. As they get stronger, we lower the machine. So that's how we initially start to train. Then we go from here.
How long it takes for a person to, it depends how fit they are, right?
It depends on their condition, yes.
Yes, so it can be longer or shorter.
Yeah. There's no, what the word I guess I want to use, there's no cookie cutter mentality to this.
You tailor it all the time.
Yes, we do. The next movement will be a torso curl. This is called a core bench. The beauty of this bench, like this machine, is we can incline it and we can decline it depending on the condition of the person. People who have bad low back pain, we always start them up high, so we have some gravity assistance so they can learn to start to contract their abdomen without going against gravity. So what they'll do is they'll lay down on their back. We just worked, as we said earlier, the erector spinae group. Now we're going to reciprocally inhibit or reset the erector spinae group by working the rectus abdominis. Okay? This is called the torso curl. If you notice, Sam's feet are up on top of these pummels here. Most people, when they do sit-ups in a gym, they lock their feet underneath. In so doing, bring your feet back up, son. In so doing, when they come up and they're pulling against this, they're engaging their hip flexors. Again, when the hip flexors are engaged, the psoas contracts. When the psoas contracts, it pulls the lumbar spine because of the way it attaches. In the 12th vertebrae, it attaches actually behind, posteriorly, on the 12th vertebral body. Yeah. So when it contracts, it pulls the back into a lordotic curve. The whole idea of a torso curl is to lengthen the erector spinae group. When you're engaging the psoas, you're creating what we call a concurrent contraction. Okay, the erector spinae, you're going into a hyperlordotic curve as well as trying to contract your abs, and you're sending a confused message to the system. So we start with our feet up. As his feet are up, he can gently squeeze down. That causes the hamstrings to contract. The hamstrings, when contracted, reciprocally inhibit or lengthen or relax the hip flexors and the quad, taking all the stress off these muscles and putting it all on the abdomen. Now, by virtue of doing that, you're not going to get the range of motion you would get with your feet underneath because the psoas is bringing you beyond what normal range of motion is in a torso curl. Normal range of motion is about 25 degrees, 30 at the most. So Sam's going to we start with fingers in the abs. He's going to compress. It's more of a compression movement. He's going to curl up one vertebrae at a time, compress, and he's going to come down real slow. It's an 8-count movement. He's exhaling as he comes up, so he gets his breathing in and vacuums his stomach and gets a peak contraction, coming down slow. Now we can change the load factor. Okay, as you get stronger, when we take the hands from the stomach to the head, we increase the resistance. Okay, so now he's recruiting more muscle fiber here in the abdomen and making it harder. As he gets proficient at that, we have him extend his hands way back, and we come up this way as well. And now he's recruiting even more muscle fiber, making things harder. Now, as he gets stronger, we add weight, we put tubing, we lower the bench. At the end, we do 10 little flicks to get peak contraction and blood flow in that shorter range of motion. Okay? So that's how we work, how we start with our core work. From there we go to postural movements. Okay? And we'll start with scapular retraction. Anything you want to add to that, Sam? Okay. We're going to start with a movement called scapular retraction. This movement is a very key postural movement. Anytime you're dealing with a rotator cuff injury, you've got to begin to strengthen the scapular musculature. Okay, there's so many attachment points on here for different muscles like the infraspinatus, the teres minor, the teres major, the rhomboids, the posterior inferior serratus, the levator scapula. You've got, again, I can go on and on in terms of the muscular attachments that are involved with the scapula. So before we start doing anything compound, we do what we call element movements and teach people how to move their scapula. And that involves these rhomboid muscles, the mid and lower trapezius, and they're key to posture. Now, what we don't want people doing is bringing their shoulders up into their ears like that. Most people live this way. The stress of being on a computer all day long, driving a car all day long, people reaching up and doing things all day long. They're always stimulating the trapezius, the upper trapezius, which can cause tension headaches. So we want to work to start to lengthen these muscles, reset them and start to strengthen these muscles to get the posture back where it belongs. So what Sam's going to do is he's first going to drop his lats, depression, and he'll retract his blades. And notice here, he's nice and soft up here, there's no stress. He's lengthening all the suboccipital muscles, and he's really isolating the rhomboids, the mid and lower trap. He's really strengthening the anti-gravity and postural muscles. Go ahead and go down. He'll lengthen fully. Again, we want to go through a full range of motion. Again, depression, and then retraction. And then down. I like to keep my fingers with people's permission so they can get proprioception or a sensation, which helps the muscle contract better. Okay? So that's good right there, Sam. That's the first movement we use.
Yes.
Then we go to scapular depression. I can show you that movement. We'll go over here. Now, we just worked retraction, and we stimulated the rhomboids. Another major player in posture is the lats. Most people are protracted, okay? They're internally rotated in their humerus, and they're elevated because of the stress on their traps. All right, now we just worked retraction to get his posture back. Now we're going to work depression. This is wonderful for suboccipital headaches because it lengthens the levator scapula, it lengthens all these suboccipital muscles, taking stress off a lot of the neurology that's back here. So he's going to grab the bar. We like to use a neutral grip because it takes a little stress off the rotator cuff as well. And if you'll notice here, he's coming straight down and depressing the lats. That's all he's doing. Again, it's an element movement. But if you were to come here and see, he's very soft up here now. All these muscles are relaxed. He's just learning to depress his lats and control his lats. Again, the lat is a major stabilizer of the core too, because it attaches in the iliac crest and comes all the way up to the humerus. Okay? And so if one side of the lat is hypertone, it can pull the pelvis out of alignment, and elevate it to one side or another. Okay, that's good, son. We can do single leg, or single arm, scapular depression, we can do single arm, depending on which side we see that needs to be corrected first. But primarily we always do double arm to really start to get people to learn how to use their lats. Is this helping?
Yes.
Good. Okay. Another exercise that we use for posture is a simple movement called glenohumeral joint flexion. We take a straight bar, you can use a broomstick, you can use dumbbells, and this movement works the mid and lower trap, which is a major key, again, in stabilizing posture. Okay? So what he's going to do, he's going to lock his elbows, he's going to relax his head, he's going to retract his shoulder blades again, he's going to raise the bar straight up. Okay, and if you were, Sam's a pretty good specimen, so if I were to take his shirt off, you would see the musculature that he's using coming right through his, you can see it coming through his shirt there. Lock your elbows out as much as you can. Good. There you go. Again, this is a great postural movement. People who get up from this movement, they feel like they're walking like this. Good. That's good right there. Thanks. Okay.
Do you, when people come to you, do you, depending on what's their major problem, you again tailor it?
Yes, we do.
So it's not just cookie cutter, it sort of varies.
No, but it's, there are similarities in rehab.
Yes.
Most people don't know how to use their scapula.
Yes.
Most people don't know how to use their lats. They make a lat pull down a bicep movement because they never engage the lats first. Or if they're doing a seated pulling row movement, it becomes a bicep movement instead of retraction, and then the bicep becoming a synergist in the action.
Yes.
So there are similarities
Yes.
with a lot, but now some people have different things that we have to do some different things. But most people in postural exercise, we do a lot of the same things because those are element movements that people have to learn first in laying a foundation to get them to compound and complex movements.
Any other exercises or activities?
Oh, there are many.
Yeah, just a few.
Okay, all right. Yeah, good idea. There's a movement called a psoas reset because again, people.
Yes.
Yeah. Because people sit so much, their glutes atrophy, the psoas shortens.
Yes.
As we get older,
Yes.
and different hormones dry up in men and women, it makes our joints stiffer, our strength levels decrease, our muscles begin to atrophy. What we're doing here, number one, we're taking stress off the lower back, the body. He's resting completely on the bench, okay? His hips are tucked into the bench in somewhat of a pelvic tilt. And all he's going to do is resist with one leg. He's got a band around his knees, and he's coming up and straightening, and his glute is contracting here. While he's contracting the glute, he's lengthening the psoas. Now, the glutes are a major player in low back stabilization. I like to tell people when they stand up to squeeze their glutes like they're pinching a penny, and they'll find their pelvis rides forward. Okay? When the pelvis rides forward, when the shift is this way, it takes a lot of stress off the lumbar spine because as the pelvis tilts this way, the vertebral bodies are lengthened, creating disc space and giving the nerves also room to breathe. Okay?
I have this special interest in baby boomers. And so they need to really think of their physical activity and exercise.
Yes.
And so if someone wants to take that advice from you to very scientific, it's all evidence-based. How long it takes for a person to learn what he should do for another year? So, I mean, you train him to do certain exercise, again, depending what is their special problem or special need. And a month or two coming here and interacting with you?
Oh, in a month we can lay a very good foundation.
Yes.
Yes.
So that the message we like to, that everyone must exercise, but it will be a good to come and see what particular area they need to focus,
Yes.
rather than just exercise in general.
Yes.
So within a month you would be able to.
Absolutely.
And then 3 months, 6 months follow-up?
Yeah, it depends on, again, what they want to accomplish.
Yes.
We have people who, once they see what we do, they like the idea of having someone oversee what they're doing.
Yes.
Be hands-on with them.
Right.
Some people want a home program. Once they get it, and they'll buy some equipment.
Yes.
And they'll do things at home and come back to us every 3 months for a checkup or a new program, etc.
So in other words, you would be able to, again, make the programs according to their need and what...
Yeah, when you understand kinesiology and you understand how muscle moves,
Yes.
you understand that the body is the ideal freeway. So you don't need weights. You can use rubber bands,
Yes.
tubing.
Yes.
So we can make use of just the body weight itself
Right.
and do certain movements without any kind of equipment. Just again, with the idea that the body is the ideal freeway.
So from the holistic health point of view, again, we have here a very important aspect and focus that we are making, that you are going to move. So what are some of your thoughts that you'd like to share?
In terms of movement,
Yes, movement and physical fitness.
we need to move. God gave us 2 arms and 2 legs so we would
Yes.
move.
Yes.
And so, again, just for blood flow, for digestive reasons, for respiratory reasons, for bone density reasons, for lean body mass reasons, all the research shows that the more lean body mass people have, the longer they live. The better their blood flows, the better their heart works, the better their digestive systems work. It's almost like a domino effect for the positive
Yes.
as we keep moving. We were meant to move, and right now, unfortunately, America has become one of the most sedentary nations in the world. And it's showing up in all the diseases that we have in this country.
Yes, and the prediction is half of the people will be obese
Yes.
in another 20 years.
Yeah.
10.
Yeah.
That is very serious.
Yes, it is.
We have got to do something.
Yes.
And we have to start somewhere.
Yes.
And so that is very appropriate, and I thank you.
Thank you, Doctor. for
And
purpose.
Sam, thank you. Thank you. Oh, it's my pleasure to introduce 2 of my friend MDs. On my right is Dr. Charles Darwin, MD. Hi, I'm glad to be here. And on my left is Dr. Ross Hee-Ha, MD. Yeah, I'm Dr. Ross Hee-Ha, MD. I'm just delighted to be here. I understand you have something to tell us about what to eat and exercise and so on. No, we don't talk, we sing. Yeah, that's right. We are singing NDs. Yeah, we are a unique there. We are the world's only singing NDs. Oh, that's a tall cane. That's right. We are 2 NDs that we do convey our message through our singing. Okay, let's get going. Eat well. Yes, eat more. More of veggies, fruits. Go nuts on nuts. Go nuts on nuts? Yeah, you should go nuts on nuts. Okay. Eat well. Eat more. More of veggies, fruits. Go nuts on nuts. Eat less. Eat less. Yes, eat less. Less of God fat. Say no to soda thought. Exercise well. Walk, jog, run, bike. Treadmill, elliptical. Till soaked in sweat. Exercise more. 5 times a week. Half hour or more. Till soaked in sweat. Okay, let's sing that once more. Eat well,
Yes, eat more. More of veggies, fruits, go nuts on nuts. Eat less. Yes, eat less. Less of carbs, fat. Say no to soda thought. Exercise well. Walk, jog, run, bike. Treadmill, elliptical. Till soaked in sweat. Exercise more. 5 times a week. Or more. Till soaked in sweat. Thank you. Thank you. Well, we thank you